My name is Dr. Jonathan Terla. I am a full-time urologist at Baho International Hospital. So I would start by defining what an overactive bladder syndrome is. So it is one of the common clinical conditions characterized by a group of urinary symptoms, which include the first one is urgency. Urgency meaning it is a sudden, strong desire to urinate that is difficult to postpone, so that the patient usually rush to the toilet whenever they feel the bladder is full and there is a fear of incontinence. So the other symptoms are also increased urinary frequency during the daytime, during the nighttime, and some of the patients might have incontinence as well. This condition is, as I said, it is common. It affects both men and women, but it is relatively more common in women, and the incidence also increases with aging, especially at the age of the 40, and in the post-menopausal women, urgency with incontinence. So strong desire to urinate, which is accompanied or followed by urinary incontinence. It is more common in females, and it has a very negative impact on the quality of life. Like it will affect the sleep, it will cause sleep disturbance because there is increased frequency in the nighttime. It affects the sexual function. It will cause anxiety and the depression. It even sometimes causes social isolation because of the incontinence that they have. So it affects both men and women, but relatively more common in the women populations. Usually the cause is idiopathic, meaning the specific cause is not known, but in some population they will have underlying neurologic disease like stroke, Parkinson's disease, and different spinal cord disorders, including spinal cord injury. But the other risk factors are like aging. So as the age increase, especially after the age of the 40, the incidence will increase, and incidence is also higher in those population who have diabetes, and those who have pelvic floor muscle weakness. Also taking excessive caffeine and alcohol increase incidence of this syndrome. With age, after the age of the 40, the incidence is around 20 to 30% in men, and around 30 up to 40% in the women. So especially overactive bladder with incontinence is more common in the women, and overactive bladder without incontinence is more common in men. So it is more common in old age, and especially in the post-menopausal women, and also men who have the bladder outlet obstruction, diabetes patients. Before that, let me discuss how can we diagnose this disease. So the symptoms that I said, like the urgency, increased frequency in the daytime, the nighttime, and also urge incontinence, are not specific for this syndrome. There are also multiple other diseases that cause this symptoms. So before we diagnose this syndrome, we should rule out other possible causes, which include a urinary tract infection, different the bladder condition like a bladder cancer, the bladder stone. Also in men, we should rule out the bladder outlet obstruction, especially secondary to the enlarged prostate. So we should rule out other causes before we diagnose this thing. We also ask the patient to keep their bladder diary, meaning they should record the amount and the type of the fluid they take, and the urine amount, also the frequency, and the absence or the presence of urgency and incontinence. So they will record these things. It's called the bladder diary. It helps us for the diagnosis, and they may need a urine test to rule out the urinary tract infection, also other causes. They may need abdominal imaging, and some of the patients might need cystoscopic examination just to see the urethra and the bladder with a camera. and very few patients might need advanced investigation like a urodynamic test. And so when we come to about how to treat this condition, the first thing is a lifestyle modification. As I said, one of the risk factors is taking excessive caffeine and alcohol. So the patients are advised to reduce the caffeine, soft drinks, sweet drinks, and also foods which have high spices. These things should be reduced. In addition, there are some pelvic floor muscle exercise like Kegel's exercise that helps to reduce the frequency as well as the urgency. And the second line management is the medication. There are certain medication that reduce the urgency and the frequency, and very few patients might need advanced intervention if the lifestyle modification and medication has failed. But these are very few group of patients. As I've said, the first line is behavioral therapy and lifestyle modifications. So to reduce caffeine, sugar, and spicy food, also the soft drinks, and also there is what is known as bladder training. We advise the patient to void at specific time interval, which will be increased over time, so that they can train their bladder to hold urine for longer period of time. And as there is pelvic floor muscle exercise, which can be shown by the physiotherapist. Once physiotherapist shows them how to do the pelvic floor muscle exercise in the proper way, then the patient can do it at their home. It doesn't need special thing. The second line is the medication. There are specific medications to treat this disease, and most of the patients will respond for this, for lifestyle modification plus medication, and very few patients might need advanced therapy. Most patients, like the more than 80% of the patients, will respond for this lifestyle modification and behavioral and the medication. But the condition is a chronic condition, and the objective of the treatment is not to cure, rather to control the symptoms, so that the patient will have better quality of life. As I said, this disease affects the quality of life of the patient, because since they have increased frequency in the night time with incontinence and urgency, so the objective of the treatment is not to cure, rather to control the symptoms, so that the patient will have a good quality of life. So it needs long-term follow-up and stepwise treatment. So when the patient have these symptoms, like urgency, incontinence, with or without the increased frequency of the urination, they need to visit their primary physician, and if it needs referral, they can be referred to the urologist. And the main thing is we should rule out other serious diseases before we diagnose this disease, because those symptoms are not specific for overactive bladder syndrome, because there are also other serious diseases that can cause this symptom, like bladder cancer, bladder stone, and bladder outlet obstruction. So these things should be ruled out by the urologist. So once we are sure the diagnosis is overactive bladder, so those simple lifestyle modification, they can control the symptoms. And if the symptoms still persist despite the lifestyle modification, and the doctor will give them some drugs that are very, very effective. So I advise them to visit a physician for the proper diagnosis and the proper treatment.